Welcome to the Endo Kids Podcast, the podcast where we help families navigate the ups and downs and in-betweens of growing up healthy. I'm Dr. Rinku Mehra, the founder of Endo Kids Concierge and a pediatric endocrinologist, and my co-host is Dr. Lindsey Waldman, who is also a board-certified pediatric endocrinologist. We are here to break down the science of hormones, share real stories, and answer the questions parents wonder about the most. So whether you're worried about growth, puberty, thyroid, or just want to understand your child's development a little bit better, you're in the right place. We believe every family deserves answers, support, and a caring partner in their health journey. So grab a cup of coffee, get comfortable, and let's tackle this topic together today. This podcast is for educational purposes only and is not a substitute for medical advice. Please consult your child's healthcare provider for individualized care. Welcome back to the Endo Kids Podcast, where little hormones meet big answers. I'm your host, Dr. Rinku Mehra, and I have with me Dr. Waldman. And today we're diving into one of the most fascinating and misunderstood organs of the body, the adrenal glands. These small glands sit on top of the kidneys, and yet they regulate stress, hormones, blood pressure, salt balance, early puberty, and survival during illness. We also are going to talk a little bit about the adrenal cortex and the adrenal and talk about the differences in those two and what hormones they are making.
So let's get started and talk exactly what is the adrenal gland, right? It's not one that you hear about too often, just like many of our other endocrine glands. But the adrenal glands are two small triangular glands that sit right on top of the kidneys. Each gland has two major parts, the outer cortex and the inner medulla. The cortex makes steroid hormones like cortisol, aldosterone, and adrenal androgens. And the inside, the medulla, produces catecholamines like adrenaline, which is something that everyone has definitely heard of.
Yeah, and these glands don't work alone, right? They're part of a bigger hormonal conversation.
Exactly. The adrenal glands are regulated by the brain. Just like we always say, everything in endocrinology starts in the brain with the hypothalamus and the pituitary. I think I've said in other podcasts, I like to call it the master of all of our hormones. And that sends signals down to those adrenals. The pituitary gland actually releases what we call ACTH, and that tells the adrenals what to do, like producing cortisol. It is tightly regulated. It's a feedback loop, just like all of everything we talk about endocrine, right, Dr. Mehra?
Yes. So, I get a lot of questions in the clinic about cortisol, both excess cortisol, low cortisol, and people are always worried about cortisol. And I think, in this TikTok era and Instagram era, I think everyone is worried that they have either too much of this hormone or not enough. And so I just wanted to break down a little bit, what is cortisol exactly? So when you hear that word, what does it mean? Because it usually gets labeled as a stress hormone, but what does it really mean in children, Dr. Waldman?
Sure. So cortisol is essential to life. We need cortisol to exist. And like you said, it is what they call a stress hormone. So it helps to maintain our blood pressure, regulate our blood sugar, control inflammation, and allows the body to respond to stress, such as illnesses, surgery, injury, or even that emotional stress that we all go through every day. Cortisol is really important during illness and during infections. Without it, child or an adult, anyone, can't maintain their blood pressure or their blood sugar levels, and they can become extremely sick.
Yes. So that brings us to what you're talking about here is adrenal insufficiency. So that is when the adrenal glands, again, they're these glands that sit above the kidney, they do not make enough cortisol. And what happens exactly?
Right. So when that cortisol is not enough, is insufficient, anyone, again, children, adults, whoever has this condition can develop severe fatigue. I'm not just talking about a little bit of tiredness, but we are talking about true fatigue. They develop weight loss, low blood pressure, which is really the scary thing, salt cravings. So they're craving things like potato chips. And sometimes they can even have some skin hyperpigmentation. So their skin gets a bit darker or maybe even bronze. That's kind of how I describe it, tan or bronze. And if untreated, they can become really sick. They can have something called an adrenal crisis, which really is a life-threatening emergency.
Yeah, and that really is due to the fact that, like you said, cortisol regulates their blood pressure and their blood sugar. And so if you don't have enough, your blood pressure can drop and your blood sugar can drop. And that's really what leads to, this signs that we see of adrenal crisis or adrenal insufficiency. Another major cause in pediatrics, which we're going to talk about later, is a condition called congenital adrenal hyperplasia or CAH, which affects cortisol synthesis. And in babies, we detect that as pediatric endocrinologists because it is a medical emergency when we see that or when a patient is diagnosed in the hospital. Dr. Waldman, when you've seen patients with adrenal crisis, what does that look like in a child?
Absolutely. It's really one of the scariest things that you can see as a physician or anyone in the hospital. It can present with severe vomiting, dehydration, low blood pressure, like I mentioned before, low blood sugar, that hypoglycemia, and even shock. And it requires immediate attention. This is going to the ER, going to the ICU type of illness. And in order to treat it, we give hydrocortisone. So we're giving back steroids that the body should be making and is not making. We give IV fluids, and this can truly save someone's life.
Yeah. And so it's really important to recognize, like Dr. Waldman said, so if your child has adrenal insufficiency for some reason, like has congenital adrenal hyperplasia, really important to be prepared and know that they may need extra cortisol or extra hydrocortisone when they're sick. And we really want to prevent adrenal crisis. That's really important. On the flip side of that, what happens if there's too much cortisol?
Right. So, of course, just like everything in endocrinology, we can have either too little of a hormone or too much of a hormone. And like you're asking, too much cortisol can lead to something that we usually call Cushing syndrome. And in children, the way that we see it is they can have some slowed growth in height, but they have this continued weight gain. When you're looking at their growth chart, they're not growing well in height, but they're gaining weight.
Yeah. So, I get a lot of questions about this when people come to see me in clinic. For example, patients are gaining weight rapidly and they're worried that it's a cortisol issue. But the one thing to pay attention to, like Dr. Waldman said, is when we're looking for Cushing's, okay, what we're looking for is the weight going up and the height percentiles falling down. Because if you're seeing a decrease in height percentiles, and that's why we as pediatric endocrinologists look at the height percentiles so closely, if you're looking at the height percentile going down and the weight going up, that's usually when we're more concerned about excess cortisol. So cortisol suppresses growth hormone action and kids don't really grow well. So that's an important pearl to recognize and understand.
That's right. And some of the other things that we can see include very round faces, high blood pressure, and sometimes even mood changes. Now, this is certainly hard in pediatrics and adolescents, as we've talked about, but all of those things going together do make us concerned for an excess of cortisol.
Yeah. So really important to understand, the difference between not enough cortisol and excess cortisol. And other hormones that the adrenal glands make do help with puberty. So let's talk about that a little bit. So adrenarche. Parents often come in concerned about early development of pubic hair, body odor, and acne. And what role do the adrenal glands play there, Dr. Waldman?
Right. So they play a major role in this. The adrenal glands produce androgens, like something called DHEA. And sometimes around the age of maybe 6 to 8, we can start to see the beginning of that adrenarche, the increase in those adrenal androgen hormones. And what we can physically see is pubic hair, body odor, and sometimes even mild acne. Now, it's really important to know the difference between this and central puberty, the puberty coming from the brain that we've talked about before, which involves the activation of the hormones from the hypothalamus, the pituitary, and then either the ovaries or the testes. And so again, this is different than that, although a lot of times we think of puberty together. So Dr. Mehra, how do you kind of help parents distinguish between the types of puberty we're talking about?
Yeah. So, if they come to see me and they have some pubic hair, hair under the arms, body odor, I do look at growth again. So I know we've mentioned this so many times, but we really look at their height percentiles and see how that's progressing and look to see if that hair has progressed rapidly. So if they tell me, that hair's just been there for a year and it's not really increasing much, I'm thinking more along the lines of the fact that the adrenal glands have woken up a little bit early, are making a little bit of excess hormone, and some kids are a little more sensitive, and that's premature adrenarche. Versus if they have rapid progression of this hair development and their growth rate increases and they have an advanced bone age, then I will evaluate for things like congenital hyperplasia or rare adrenal tumors or something that's really causing the adrenals to make a lot of extra hormone that's having a physical impact on the body.
It's a really important thing that if you're worried that you are noticing signs of this in your child, certainly to talk to your pediatrician and then potentially seeing a pediatric endocrinologist like one of us to help kind of differentiate between all of these different things that could be happening. Again, the most likely case is this is just adrenarche. These hormones are waking up a little bit early and it's totally benign, but we could always help you through that process. Now,
Exactly.
we've talked about the adrenal cortex. Tell me a little bit about the adrenal medulla and what that does.
Yeah, so the adrenal medulla produces catecholamine. So really what that is, adrenaline and noradrenaline. These hormones actually control fight or flight responses. So rarely children can develop tumors that overproduce some of these hormones. Those tumors are called things like pheochromocytoma, and these kids can present with episodic headaches, palpitations, just sweating, and severe high blood pressure. This is pretty rare, but if your child is having some of these symptoms, really important to get evaluated by a pediatric endocrinologist because it's something rare, but it's something that you don't really want to miss.
Yes, just like you said, they're really, really important things that we certainly wouldn't want to miss. So let's kind of move on to testing. So a patient comes into your office and they're worried about their adrenal hormones. What are some of the things they can expect?
Yeah. So, I think that we do evaluate hormones and we do blood tests. For deficiency in cortisol, we will check a morning cortisol and the ACTH level. If the results are unclear, we may do something called an ACTH stimulation test. For conditions like congenital adrenal hyperplasia, we measure other hormones. And for Cushing's, we do screening tests like a late night salivary cortisol or dexamethasone suppression test. I think what I want to go back to a little bit is talking a little bit more deeply about some of these conditions. For example, we've talked about congenital adrenal hyperplasia, and this is a condition, also people call it CAH, so congenital adrenal hyperplasia. This is a genetic condition where the adrenal glands cannot properly produce cortisol, most commonly due to a deficiency in one of the enzymes. We call that 21-hydroxylase. And as a result, the adrenal gland overproduces what we call androgens, which are, hormones like testosterone, which is an androgen. So the results that we see, and really this, like I said, is an emergency for a pediatric endocrinologist. We often get calls from the nursery. So when the child is born, especially if it's a girl, we are usually called immediately to the nursery because these symptoms can develop very, very early in utero for these babies, and they can have their labia look different, okay? And they can have rapid growth as toddlers. But really what we're worried about in babies who have this condition is salt wasting or severe salt wasting crisis, adrenal insufficiency, which Dr. Waldman talked about earlier. So with the newborn screening program, we can detect this often before the babies even leave the hospital. That's really important to look at a newborn screen for a baby, the hormone labs like 17-hydroxyprogesterone and ACTH stimulation testing, because that child needs to be treated immediately before they even go home to prevent adrenal crisis. And we need to treat with steroids like hydrocortisone, fludrocortisone, and even salt or salt tablets. So we are treating these babies. So really important to know that congenital adrenal hyperplasia is a rare condition, but it is genetic, and there's treatment for it.
Yeah, it is an emergency. And a lot of what our job is education for the family, right? Not only, to prescribe these medications, but to teach them what it means lifelong, how to prevent things like those adrenal crises, what happens when the baby gets sick, right? What happens when they have a fever, just like every child baby does multiple times. And that is our job as an endocrinologist to kind of hold the family's hand through that so that their kids can grow up happy and healthy and wonderful, just like everybody else. Let's talk a
Exactly.
little bit more about adrenal fatigue. I don't know if you've heard of that one. I think that's a pretty hot topic, maybe also in the TikTok world. Tell me a little bit about adrenal fatigue.
Yeah. So, adrenal fatigue is not really a recognized medical diagnosis. Okay. So, we talked a little bit about adrenal insufficiency, and I want to go back to that. Like Dr. Waldman said before, adrenal insufficiency occurs when the adrenal gland does not make enough cortisol. So, those symptoms are severe fatigue, low blood pressure, weight loss, dizziness, and in severe cases, adrenal crisis, like we talked about earlier. Adrenal fatigue is different, just being very, very tired overall and thinking that their adrenal glands are not functioning the way they should. Oftentimes, there's something else going on. The evaluation for patients with adrenal fatigue should include a thyroid evaluation, should include their sleep, maybe their iron levels and their blood count to make sure they're not anemic. And overall, their mental health, make sure, that they don't have depression or anxiety. But adrenal fatigue really, we need to evaluate to make sure their cortisol levels are normal. And if they are, they really don't need hydrocortisone supplementation because that's dangerous to give somebody a steroid like prednisone or hydrocortisone when actually their adrenal glands are functioning normally.
Right. And so, everyone goes through a lot of stress. Every day we go through a lot of stress. But really, the adrenal glands don't necessarily wear out from that stress. And so, again, like Dr. Mehra said, it really is not a recognized medical condition in which we treat with steroids, hydrocortisone, et cetera. There are other things that can go wrong with the adrenal for sure, but adrenal fatigue is not necessarily one of them.
Yeah. I want to go back and talk a little bit more deeply about Cushing syndrome because that's something that patients are also worried about. And they're worried about, when I see them in the office, usually they're worried about rapid weight gain and stretch marks. Okay. That's the type of concern that I have patients coming either from their primary care doctor or another physician. I had one recently from a dermatologist saying, this patient has stretch marks and has been gaining weight despite doing everything else. Cushing syndrome, can present with rapid weight gain. Okay. Cushing syndrome occurs when the body produces too much cortisol. In children, like we talked about earlier, it may present as rapid weight gain and slowed height. So again, their growth is important to recognize. And then they can have a round face, stretch marks, and high blood pressure. When we evaluate as a pediatric endocrinologist, and we don't expect pediatricians or other physicians to evaluate for this condition, but we know how to evaluate for it. We will do cortisol testing and imaging. And treatment usually is different depending on where the hormone is coming from. So it could come from the adrenal glands itself, or it could come from the hormone that regulates the adrenal glands called ACTH. So we need to recognize that quickly and evaluate that. But oftentimes, if we're doing a cortisol level or a late night cortisol level, and that level is normal, we usually have ruled out Cushing's. And so I don't know if you have other, ways that you talk to patients about Cushing's, but it is a rare condition. I have probably seen it twice in my medical career, which is, real Cushing's. And most of the time, we evaluate and the cortisol levels are normal.
Yes, I was going to say something very similar. It is extremely, extremely rare. And again, the growth chart, which we mentioned earlier, is a very important piece of this puzzle. Like we said, yes, there is rapid weight gain, but the height is slowed. So if on the growth chart, the child's coming in is growing beautifully in height along with that weight gain, it is very, very, very unlikely. I will never say never, of course, but it is exceedingly unlikely that Cushing's is the reason for that weight gain. And like you mentioned, a lot of times with true Cushing's, we will see the increased blood pressure and also increased blood sugar. So those can be other things that we see along with it. And cortisol testing can be very annoying, just like some of our other hormone testing. We ask to do those late night cortisols because timing is extremely important. There are other ways to test for it. Sometimes we ask patients to collect urine for a long period of time, which certainly can be annoying. But if we certainly want to make the diagnosis if we are suspecting. So we have to test the right way.
Exactly. So, really important message to say is if you're worried about Cushing's in your child, see a pediatric endocrinologist, see one of us. I think it's important to have peace of mind to know that your child does not have Cushing's, and we can help guide you with that. And then, the last condition I really wanted to go over a little bit, we've talked about it, but premature adrenarche. So we talked about this early activation of the adrenal glands, early androgen production. It can cause body odor, pubic hair, or mild acne before the age of 8. Or before the age of 9 in boys without other signs of true puberty. It's usually benign. We do monitor growth, and it can be linked to future insulin resistance. So we really want to know about that. I think the guidance I would have for parents is if you just don't know, just see a pediatric endocrinologist because sometimes it's unnerving to see pubic hair in the arms in your 6-year-old child. And so I think it's important for you to know that we can help you make that assessment rather than you thinking it's normal. So just, a few words on that. And then, the rare conditions that we talked about, adrenal tumors and pheochromocytomas, which can cause high blood pressure, excess hormones, and require surgical management. Those, again, rare, but those are things that we see and can evaluate for. So just a few tips on that. So, Dr. Waldman, I have a few rapid fire questions. What patients are Googling at 2 a.m. I think we've addressed some of these. But, why does my child have body odor at the age of 6? And so I think parents are Googling that. What would you tell them?
They certainly are. And what I would tell them is they should come in for an evaluation. Most of the time, the overwhelming majority of the time, I will say, it is totally normal and benign and is caused by this activation, this awakening of the adrenal glands. But it is our job to look for anything else that can lead us down a road of maybe another condition. So it's definitely worthwhile talking to your pediatrician and possibly pediatric endocrinologist about it. Again, the overwhelming majority of patients, it is going to be benign and just something that we watch.
And, what is an adrenal crisis and how would I recognize it? So what would you tell parents who are looking for that?
Sure. So I would say number one, it's rare, but it is life-threatening. So knowing that it is very rare, I think is important. But certainly when a child has adrenal insufficiency or a problem with their adrenal glands to begin with, certainly it can be very scary and life-threatening. And really, again, that's going to look like dehydration, severe fatigue in your child. I mean, they are lethargic, right? That is a word I will use to kind of describe it. Low blood pressure, low blood sugar. You are taking them to the ER so that physicians there can assess and can treat them.
Yeah, I think that's a very, important point to make. For my patients who do have adrenal insufficiency, for example, their body's just not making enough stress hormone because, either they have some damage at the level of the pituitary gland or they have congenital adrenal hyperplasia. I think it's also important to recognize that when they're sick with an illness, like they have a fever over 101 or like they had the flu, or they're going to have surgery or something, we usually often recommend extra stress hormone for those patients just to prevent adrenal crisis. But we do offer a lot of guidance and education regarding prevention of adrenal crisis in those patients. If you're, worried about that in your otherwise healthy child, we'd also be happy to talk to you about that. But that requires testing. So we need to test the gland just to make sure that everything is working the way it is. So another question that I get, and this is from some patients who are asking for this on social media also, is can stress damage my child's adrenal glands? So what would you say to them?
So I would say stress is real. We all know that. It certainly can affect our overall health in many ways, but stress itself will not affect the adrenal glands. They will still produce the hormones they are meant to produce. That being said, we do need to take stress seriously, work on ways to decrease it. And when we do have it, work on ways to deal with it. And I think that's very important to start with our children, our patients when they're young, teaching kids what to do in times of stress, how to deal with their stress so that they have those tools as they get older, I think is very, very important. But I will say that it can't really damage the adrenal glands.
The flip side to that is, can steroid medications damage the adrenal gland? So what would you say to that?
So yes, they definitely can. Now, If your body is not making enough of that steroid, yes, you need it. We want to give back what your body should be making. But if your body is making it, yes, and you are taking extra, then absolutely. So like we said, everything is a feedback loop. Everything works together beautifully. But if you're taking steroid, then your adrenal glands see that you have a lot going on. Your hypothalamus, your pituitary sees it. It will work to decrease the amount that your adrenals are naturally making. And so the adrenals won't work as well. If you stop taking that steroid for whatever reason, your body takes a bit of time in order to wake back up. And so there might be some time that you are at risk of getting very, very sick. Unless you see an endocrinologist who tells you that you have a problem with your adrenals, what that problem is, and we need to give back what your body should be making, you definitely should not be taking steroids, should question why you need them. Certainly, steroids are used in many illnesses and are needed in illnesses, and those doctors can talk to you about how it affects your adrenals, but you need to be very careful about what you're seeing in social media, getting off the internet. You don't know what you're buying, and it makes me very nervous.
Yeah, I mean, I've had people who have taken steroids from, buying things online, and it definitely affects their adrenal glands. And so really important to really think about that and get another opinion by a physician who can guide you rather than purchasing some of these things online. It's pretty dangerous, I would say, from what I've seen. But, in closing, I just want to say the adrenal glands are small, but they're very powerful regulators of stress, growth, salt balance, and hormone development. Most children will never experience serious adrenal disease, but when symptoms are persistent or unusual, the evaluation matters, and early diagnosis and treatment allows children to live full and healthy lives. Exactly. And if you think that there is another parent who would benefit from this podcast, please like and share this podcast. And until next time, I'm Dr. Mehra, and we have Dr. Waldman with me. And thank you for listening to the Endo Kids Podcast.
Thank you so much for joining us on the Endo Kids Podcast. We hope you're leaving with a little more knowledge and a lot more confidence. If you have questions, stories, or topics you'd love us to cover, please send them our way. We love hearing from you. And don't forget to check out our website, www.endokidsconcierge.com, for free resources, guides, and more ways to connect. You're not alone on this journey. We're here to support you and your family every step of the way. If you enjoyed this episode, don't forget to subscribe to our podcast so you never miss an update.